Chapter 11, Interpreting Physicians' Orders for Dosages and Day Supply. So we have our objectives, what we're going to learn in this chapter, and then we have our keywords, which we'll go over in the chapter. So, of course, there's a pretest at the beginning. You can use this to try to test yourself, or you can take it after. It's really good to have all these different types of practice problems available to you. The objective of this chapter is to bring together mathematical skills learned in previous chapters to accurately prepare medication for dispensing, given the information provided on a prescription. In some instances, the medical professional omits the number of doses of medication necessary or the dose to be given from a total dosage. In many instances, because only one element is missing, pharmacy staff can make the necessary calculation from the prescription without contacting the physician. This chapter provides the knowledge base needed for making those accurate decisions for doses and dosages. So determining the appropriate quantity for dispensing, dosage. As long as the physician provides a time frame for a prescription, the pharmacy staff is responsible for ensuring that the patient has sufficient medication to complete the desired medication cycle. Basically, the total dosage needed is the number of doses needed per day times the total number of days prescribed. This can be calculated with dimensional analysis, which of course we're not going to do, or in the case of solid medications, ratio and proportion. So let's start by doing example 11.1. All right, example 11.1, we have the prescription amoxicillin 500 milligrams. The SIG is 1 TID for 10 days, and we need to dispense enough capsules to be taken for that time period. So we just need to do simple multiplication. So they're taking 1 tablet 3 times a day. Means that they are taking 3 tabs per day. And then they are taking 3 tabs per day times 10 days. So 3 times 10 is 30 capsules. With prescriptions such as this, most pharmacists will expect you to do a quick mental calculation of the answer because it's just simple multiplication. Never forget to use your common sense when looking at your answers. If a prescription is written for 4 capsules a day for 7 days, simple multiplication gives you the answer of 28 capsules. And that's the same process if we were to set this up as a ratio or proportion, which would take longer to solve. Example 11.2, we have the RX Septinir 125 milligrams per 5 ml. This SIG is 125 milligrams BID for 10 days. How many ml are needed for the entire course of therapy? So just like in the previous chapter where we were setting up one side of proportion with the strength of the medication, we would need to do that if the SIG was for like 250 or 260 or if it was for a different amount. But if we look at it, it's for the amount of 125 milligram per 5 ml. And remember when we talk about in pharmacy, we're going to use ml. So the patient is going to take 5 ml times twice a day for BID. So 5 times 2 is 10. So that means they're going to take 10 ml per day. And then if they're going to take 10 ml per day, and they're going to do that for 10 days, that means that we need to give them 100 ml. Example 11.3, a physician prescribes phenobarbital GRI, so that's 1 grain by mouth every 6 hours for epilepsy. Provide a month's supply. In stock, we have 30 milligram tablets. How many tablets should be provided to fill the prescription? So 1 grain is equal to 60 milligrams, and we have 30 milligram tablets. How many grains are those? So we have 60x is equal to 1 times 30. And then we want to take care of that multiplication first. So now again, we have 60x is equal to 30. We want to get x alone. So we're going to divide this side by 60 to get x alone. And then we're going to do the same over here, which means that these are 0.5 grain is what we need to get the 30 milligrams. So they're doing that every 6 hours, which is 4 times a day. Now we'll multiply 0.5 times 4, which gives us 2 tabs. So that's how much we're going to need per dose. So 2 tabs is what they need per dose. And they're doing that 4 times a day, which is 8 tabs per day. And they are doing that for 30 days. And that is going to be 250 tabs. So if you look at the example in the book, it is using dimensional analysis, which again, we here at Ross don't. We could have set all of this up as a proportion. I just wanted to show you in the book, really, even this is the new edition of the book, and they really focus on learning these things as much as possible in your head. And I don't mean in your head, but like quick calculations to do while you're working, because that is what you're going to have to do in real life. So the previous edition of this book actually had more formulas that were just really confusing, and you can just do simple math like this. But if you use DA and it works, and if you even want to set these up as ratio and proportion, you can do that as well in all of these steps. Okay, so example 11.4, on Friday, a doctor orders Tagamet 300 milligrams IM every 6 hours to be sent to the hospital floor for the weekend. In stock, we have the cimetidine 300 milligram per 2 ml strength injection in an 8 ml multi-dose vial. How many vials should be sent for Friday noon through the weekend with a sufficient amount to provide the medication on Monday at 6 a.m.? So if they're doing the medication every 6 hours, we know that's 4 times a day. If we don't, we can take 24 and divide it by the number in between Q and H, and that would give us 4 times a day. We need to start giving this med at 1200 hours on Friday. And then we need to give it every 6 hours from there. So 6 hours from noon is going to be 6 p.m. So that's going to be 1800 hours. And essentially they're going to take it at 1,200 hours, 1,800 hours, 6 hours from 1,800 hours is midnight, which is 000. And then again at 6 a.m., 0600. So that's what we have on Friday. Saturday, we need to give them the medication at all the time. So 000, 1,200, 1,800, and 0,600. And same with Sunday. And then Monday, we would need to give the medication at 0,100 hours and 0,600 hours. So this is 2 doses, 4, 4, and 2 doses again. We add that all up. 2 plus 4 is 6, plus another 2 plus 4. So we need to give 12 doses. Now, the medication is dosed at 300 milligrams per 2 ml in the bottle, and we need to give 300 milligrams. So that means that we need to provide 2 ml for each one of those doses to have enough. So that 2 ml for 12 doses, 2 times 12 is 24. That means that I need 24 ml, and there are 8 ml size vials. So if one vial is 8 ml and I need to give the floor 24 ml, how many vials is that? So of course we just do our proportion. 8x is equal to 1 times 24. We'll do our multiplication over here and we'll have 24. So 8x is equal to 24. Now we need to get x alone, so we're going to get rid of it by dividing by 8 here. Now all we have left is x. And then we have to do the same on this side. So we're going to do 24 divided by 8, which means we need to provide 3 vials. Determining the number of doses in a container. If the size and frequency of the dose and the amount of medication in a container are known, the number of doses in the container can be calculated to ensure that the patient has a sufficient amount of medication for the expected time of administration. Basically, the number of doses in a container is the total amount of medication divided by the dose size. So let's look into 11.6 example to see what that means. Example 11.6, prescription for furosemide 80 milligrams by mouth daily for 1 month. How many doses are in a 100-count stock bottle of 40 milligram tablets? So you should be able to, at some point, look at this type of problem and know that in order to get 80 milligrams, we would need 2 of those 40 milligram tablets. But if you didn't, you can set up a proportion and do, okay, so if 1 tab is 40 milligrams, how many tabs to make 80 milligrams? And you just do a proportion by doing 40x is equal to 1 times 80. And then, of course, doing your math, which is 80. And finding out that that's 2 tabs per dose. So we can do a proportion doing what we have. So we know we need 2 tablets for 1 dose. We have a 100 tab bottle. How many doses is that? And then we just do 2x is equal to 100 times 1. 100 times 1 is 100. We have 2x. We want to get x alone. So we need to get rid of that 2. So that leaves us x. And 100 divided by 2 on this side, that gives us 50 doses. Example 11.7. We have an RX for Keflex suspension, 125 milligrams per 5 ml. The SIG is 125 milligrams every 6 hours for 10 days. So right there, we can look at that and say, well, they want 125 milligrams, which is 5 ml. So that means for every dose, they're taking 5 ml. So 1 dose is equal to 5 ml. We have a 60 ml bottle. How many doses are in there? So how many times can they take that 5 ml they need every 6 hours? So we have 5x is equal to 1 times 60. We want to get x alone. And of course, 1 times 60 is 60. So we're going to divide each side by 5. And we get our calculator and do 60 divided by 5, and we get 12 doses. Determining the length of time a prescription will last, day supply. It's important to know how to calculate the length of time a prescription will last according to the directions, which is called day supply. Pharmacists use this information to monitor a patient's compliance with their medications. Additionally, care must be taken to input the correct day supply in the computer for insurance purposes. One of the common reasons claims are rejected is for incorrect day supply. Also, refills are only approved after a specified period of time has passed based on the day supply. If an attempt is made to refill too soon, the claim will be rejected. So just some notes here. If the proper length of time between a prescription refill is inappropriate, the pharmacist should be notified and will consult with the patient and the physician for clarification. When calculating day supply for insurance purposes, we're always going to round down to the closest whole day number if you calculate a partial day. This will help avoid refill too soon responses. Determining day supply for tablets and capsules is the simplest of the calculations. Oral and IV liquids, insulin, eye and ear drops, and inhaler calculations require the most steps. Labels for inhalers will state how many inhalations are present in each container. Some medications intended for inhalation need to be placed in a nebulizer, which is a device used to produce a fine spray of medication. These calculations will depend on whether the medication is supplied in single or multi-dose containers. All right, let's do example 11.8. Sample 11.8, a physician orders 60 tablets of an antibiotic to be administered QID. What is the day supply? A lot of the times when we have antibiotics, the doctor will put how long they should take it for. Like they'll say, take 1 tablet by mouth 4 times a day for 10 days and tell you how much to dispense. This time they're giving us how many tablets they want us to dispense and how many times a day the patient takes it. So we're just going to do a simple division problem of 60 divided by 4. That means that this prescription is going to last for 15 days. Example 11.9 is a prescription for an eye drop, Ocuflox. Ophthalmic solution, 5 ml. Sig is 1 drop, 1 GTT, each eye, QID times 5 days. It tells us in the book that we should use 20 drops per ml for calculating day supply for insurance purposes. And what is the day supply? Use 2 drops per dose because the prescription is written for both eyes. So if we use what I just said, the 1 ml is equal to 20 drops, and we want to find out how many drops are in the bottle. So our bottle is 5 ml. You know, we want our ml up here and our drops here. Now I just do 1x, which is x is equal to 20 times 5. So that means that there is 100 drops in the bottle. Now we need to find out how many drops they're using. So they're doing 1 drop in each eye, which it told us that we should use 2. So we are using 2 drops. And then we're doing 2 drops 4 times a day. So 2 times 4 is 8. That means we're using 8 drops a day. So then we would just do 100 drops that are in the bottle divided by the 8 drops a day we need. So we'll just take out our calculator and do 100 divided by 8, which gives us 12.5 days. So even though the prescription says to only take it for 5 days, this is the calculated day supply that we would use for the prescription, because that is how long the bottle would last. All right, so for example, 11.10, we have this medication label for Dilantin 125. The strength of it is 125 milligrams per 5 ml. We have a prescription for 100 milligrams TID, and how many full days should this bottle of medication last? So first we have to find out how many milliliters they're taking per dose. So we need the strength of the medication on one side of the proportion. Remember, it can be either side. They're equal to each other, so it doesn't matter. We'll get the right answer no matter what way we put them. And then, of course, we need our same units on top and on bottom. We're looking for how many ml, and we need to give them 100 milligrams. So over here on this side, we are trying to find out how many ml per 100 milligrams. We know that 5 ml is 120. But we want to find out how much 100 is. So we have 125x is equal to 100 times 5. 100 times 5 is 500. And we have 125x. We want to get rid of the 125 to get x alone. And we take out our calculator now to divide that 500 divided by 125, which gives us 4 ml per dose. All right. So they're taking that 4 ml 3 times a day. So 4 times 3 is 12 ml per day. And the bottle says it has 237 ml. So 237 ml in the bottle divided by the 12 ml we're going to give per day. Simple division problem. And we'll do 237 divided by 12, which gives us 19.75 days, which we would round down to 19 days. Example 11.11, it's essentially the same type of problem that we just did, except for this is about how long an insulin vial lasts based on how much the patient uses it. So first thing first, we need to find out how many units in our insulin bottle. You should know at some point that there are 1,000 units in each bottle, but to figure that out, remember that insulin is U100, so that means that there's 100 units of insulin per 1 ml. And if we have a 10 ml vial, how many units are in that? And then you just figure it out by 1x is x. It's equal to 100 times 10. You multiply that and you get 1,000. So there's 1,000 units. Oops. There's 1,000 units in a U100 insulin bottle. So we need to find out how many units they're using per day. So they're doing 50 units in the morning at breakfast and 40 units in the evening. So if we add up that 50 plus 40, that means they're taking 90 units per day. And we have 1,000 units in the bottle. And they're taking 90 per day. We do our simple division problem of 1,000 divided by 90. And we get that it's going to last 11.11 days, which we would round down to 11 days. Example 11.12, we have Provental inhaler, 17 grams, 2 puffs QID. In stock, we have the 200-meter inhalation bottle. What is the day supply? So there's 200 puffs in that bottle. Now we just need to divide that by how many puffs the patient's going to use a day. So 2 puffs 4 times a day. 4 doses is 8 doses per day. Divide that by the 8. Well, let's say 8 puffs. 200, let me erase that, that looks terrible. So 200 divided by 8 means that this will last for 25 days. Example 1113, we have acetaminophen with codeine elixir, 120 ml. The sig is 5 to 10 ml every 4 to 6 hours, pure in pain. What is the day supply for the following prescription? So we need to figure out how much the patient's going to use per day and divide that by the amount in the prescription, which is 120 ml. So it says 5 to 10 ml. That means the patient can take 1 to 2 teaspoons, just depending on how they feel. We always have to assume that they're going to take the most amount. So we are going to assume that they're taking 10 ml. And then we have that they're taking every 4 to 6 hours. So we're always going to assume that they're taking it every 4 hours when we have that, even though they can take it every 4 to 6 hours. So if we do 24 divided by the 4, we know that that's 6 times a day. So they can take 10 ml 6 times a day for their prescription. So if we do 10 times 6, that means that they can take 60 ml per day. And if we're dispensing a 120 ml bottle and they can take up to 60 ml per day, how many days is that going to last? And we're going to do a little calculation. So 120 divided by 60, that means this is only going to last 2 days. And that's actually pretty normal for pain medication. We wouldn't usually see a very long day supply on. In some cases, we may be asked to calculate the amount of medication to be dispensed when the number of doses per day and the number of days for treatment are known. On other occasions, the calculation of the number of doses of medication in a container may be necessary to ensure the patient has adequate medication to complete the prescription or the physician's order. Finally, for determining day supply for insurance purposes, for monitoring refills to assess patient compliance, and for meeting insurance companies' regulations regarding restrictions on the amount of medication that can be dispensed at a given time, pharmacy staff will be required to determine how long the medication should last if taken according to the directions. All of these skills may be needed to accurately dispense medication. And this is, again, something that you're going to do quite a bit. So definitely make sure you have this chapter down by checking out all the different practice problems you have available to you.